Thank you everyone for joining us and welcome to our event. Today we will be looking at infection prevention and control and addressing blood exposure. I will be your host today. My name is Alyssa Longi. I'm a public health program manager at NCUIH. I've been working on this project for a couple of years now. I'm also a registered nurse and I'm Fort Peck to Assiniboine. And I'm calling in today from Seattle, Washington. So this event today is the first in our series where we're going to be looking at incorporating microlearn training resources when it comes to infection control. And as I mentioned, today will be on bloodborne pathogens. Next slide. Just a little disclaimer, today's session will be recorded for educational and quality improvement purposes. We ask that you please turn your video on if you can. Mute yourself when you're not speaking and introduce yourself in the chat by providing your name, organization, and any tribal affiliation. And my colleague Zoe will be monitoring the chat if you need anything today. For today's session agenda, it'll go through the following outline. We will do our introductions. We'll have a main lecture component. We'll do a little bit of resource sharing. We'll have an open floor, and then we will do closing. And then the objectives are written out here on the screen for you. I won't read all of them word for word, but we mostly want to talk about the benefits of microlearning, increase awareness, and then also outline and really do a breakdown of the blood microlearn. And then we will ask if you could complete our survey at the end. There'll be a link in the chat. You can also scan the QR code, and you'll see the QR code at the bottom left corner of the slide throughout the presentation. Provide some background on NCUIH. The National Council of Urban Indian Health, or NCUIH, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is a national representative of the 41 Title V urban Indian organizations under the Indian Health Service. In the Indian Healthcare Improvement Act, NCUIH strives to improve the health of the over 70% of AN population that lives in urban areas. NCUIH also acknowledges that our national office in Washington, D.C. and nearby activities are situated on the traditional homelands of many Native nations. Some of the communities in the surrounding area include the Piscataway, the Pamunkey, Nantego, Mattaponi, Chikamini, Monacan, and the Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native peoples. So we'll just take a brief moment here to recognize and reflect on what I just said. Next slide. We also want to acknowledge that NCUIH is proud to be a partner with Project Firstline as supported through our cooperative agreement. The CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent policies of CDC or HHS and should not be considered an endorsement by the federal government. A little bit about Project Firstline. It's a national collaborative led by the CDC to provide infection control training and education to frontline workers. And NCUIH is one of more than 75 partners across the country who are working to provide innovative and accessible infection control education. All right, so now we will move on to the main content of the presentation. We're really excited to have Shay Drummond from the CDC here with us today. I'll go ahead and go to the next slide. Brief introduction. So Shay Drummond is Project Firstline's infection control subject matter expert. Prior to joining Project Firstline, Shay was an infection preventionist, quality management consultant for the VA healthcare system, and has frontline nursing experience in disease surveillance, outbreak response, and public health. She's presented with us before, so we're really excited to have her here today with us. Shay, I will go ahead and pass it over to you.
Thank you so much. Well, hello and welcome everyone. Thank you for taking time out of your day to join our session on Project Firstline Microlearns featuring bloodborne pathogens. Next slide. Before we get started, I wanted to let you know I do not have any conflicts of interest related to the presentation today. And for our agenda, we're going to actually dissect the Project Firstline Micro Learn What to Do When You See Blood. We will cover bloodborne pathogens along with how you can use the microlearn to teach infection control actions to avoid blood exposure and provide resources and tools to support you and your facility IPC training and exposure control plans. Next slide. For our learning objectives, by the end of this session, you'll have the ability to list some of the common germs that live in the blood, identify healthcare tasks involving blood, explain the importance of preventing bloodborne infections in healthcare settings. You'll be able to discuss the use of personal protective equipment and those infection control actions that you can take for prevention of bloodborne infections. And we'll also provide you with some links and resources that we're using today, including the CDC core practices, standard precautions, and the OSHA standards. Next slide. So today's presentation is not about administering your facility's annual required OSHA bloodborne pathogens trainings, but I did want to touch on it briefly so that you can see that tie-in with using the blood microlearn as a tool that you can use to provide and augment training on bloodborne pathogens in your healthcare setting. So just a little quick review of the OSHA standard 29 CFR 1910.1030. So this standard is required to be implemented, and it's done in order to reduce and eliminate the hazards of occupational exposures to bloodborne pathogens. And the employer must implement an exposure control plan for the worksite with details on employee protection measures. The plan also must describe how the employer will use engineering and work practice controls, personal protective clothing and equipment, employee training, medical surveillance, hepatitis B vaccinations, and other provisions that are called for in this standard. The CDC, NIOSH, and OSHA have been collecting data over time, and I think one of the interesting nuggets that came out of that is the data that they've collected, that implementing these plans demonstrates that facilities that do value safety and sharps injuries have fewer sharps injuries overall. And they've actually pulled out some interesting characteristics of these facilities, which include sharps injury prevention. It's highly valued by the entire organization, including the executives, that management and staff have a shared commitment to prevent sharps injuries, and that staff members are very much encouraged and supported to report those sharps injuries promptly, and they really overall support that individual accountability. So all the reasons we're gathered here today to talk about blood. So next slide. So what is a microlearn? On the slide, you see the colorful graphic, and that is the microlearn for our bloodborne pathogen training today. And these microlearns were actually designed from formative research that was conducted by one of our Project Firstline national partners, RTI. And this research was actually conducted in having conversations with frontline healthcare workers in all types of roles and settings. And what they shared was, as adult learners, they had extremely busy schedules, and that their preferred method of learning were actually these small bite-sized chunks of learning. They also wanted visual content and really quick key takeaways that they could put into action. So basically, provide me the information, tell me what I need to know and when to do it, and give me the science behind it. The Project Firstline microlearns are a series of guided discussions that provide those brief on-the-job educational opportunities. Each of these microlearns focuses on a single infection control topic, and currently we have 5. The topics that we currently have are blood, cough and congestion, rash, diarrhea, and draining wound. And all of these we've done, in addition to English, we have Spanish versions, and they're all on the PFL public-facing website. What's cool about these microlearns is they actually connect the infection control concepts to those immediate, practical, valuable actions to the healthcare worker. And healthcare workers can use the risk recognition, which we've talked about in previous Project Firstline trainings, and easily take these key points to their daily work and perform those recommended actions to keep germs from spreading. Next slide. A little bit more about the microlearns. So when you go in and pull up the microlearn on our website, you're going to see that they're actually a 3-pager, which includes a discussion guide, your facilitator notes, and a colorful job aid that you saw on the previous slide. It's recommended that prior to deciding to use one of these microlearns, that you have to do a little homework on your side to get ready. Part of that is going to be check your policies and procedures at your facility and adapt the content of what you're going to teach through the microlearn tool to incorporate elements of those documents that you need or want your staff to be aware of. So the discussion guide that comes with is not really meant to be the script, but rather having the facilitator connect the content to the learner and the facility. So it gives you that ability to really personalize this training to your setting and to your healthcare worker roles. The microlearns can also provide a really good jumping off point if you have facility specific discussions that you want to have with your healthcare workers. It could be on your SOPs or updates or changes to policies and procedures, tax and processes, or even outbreak response. The microlearns can also be easily incorporated into existing groups where you're meeting with your healthcare workers. So this could be your pre-shift huddle or those weekly team meetings, and even be woven into employee orientations. We do recommend, as part of the creation of these microlearns, that the sessions be led or facilitated by an experienced team member that does have infection control experience. Other areas that we've seen microlearns used quite successfully is after ICARs, for pre and post survey visits to your facility, and in times of outbreaks when you might want to do some just-in-time training on the fly to remediate maybe a specific IPC gap, or as a quick refresher, maybe for a new specific disease or symptomology that you want healthcare workers to have better awareness. A few other little additional elements of the microlearn that are important to point out before you start using them is that the microlearns are really designed to be implemented with infection control risks with patients and in the patient environment. So not factoring in necessarily visitors or other staff members. And then a final point is that all the microlearns have a little caveat in it, and it's part of teaching it, is if there is a patient that has any sort of a health issue, they're in distress, let's say they have shortness of breath or bleeding, that the staff should really drop everything and respond to that emergency according to the facility protocols. Next slide. All right, so let's start to put the pieces together on how to present a microlearn. And the steps I'm going to go through today are actually taken directly from the facilitator guide that comes with each microlearn topic. So step one, we're always going to start with that basic information. So today's topic with blood, always act as if blood is infectious. That is our main topic of the day. We always want to impress that bloodborne pathogens are infectious microorganisms or germs that can be present in human blood that can cause disease. These pathogens are not limited to, but include hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. And what's tricky is that people are often infected with bloodborne pathogens and don't always have symptoms, but their blood and some of the body fluids still have the virus in them that can be transmitted. There is the risk. Workers in many occupations, including our first responders, environmental services, nurses, and other healthcare personnel, all may be at risk for exposure to bloodborne pathogens. Next slide. So step two, you're going to introduce the topic. So As we said, germs can live in the blood, and viruses like HIV, hepatitis B, and hepatitis C can spread in healthcare when contaminated blood is on a sharp item or splashed and sprayed, or even present in the environment and on reusable medical equipment. This is really an interesting fact that I didn't know until doing some research to put together some of our presentations recently. The CDC has estimated that approximately 385,000 injuries with contaminated needles and other sharp devices occur every year among hospital-based healthcare personnel. That's over 1,000 injuries a day. Many more go unreported, but we know that occur in other healthcare settings such as emergency services, home care, and nursing homes. Injuries with contaminated needles and sharp devices are an important concern because they do pose that risk of transmission of blood viruses, and they're costly to personnel with time off, lab results, potential prophylaxis, and not to mention just the overall mental stress caused by an exposure. So what are your chances of an infection from a contaminated sharps injury? If you're not vaccinated against hepatitis B, you have a 1 in 5 chance. And you noted that on the OSHA standard that vaccines is an integral part of that OSHA standard, and that is one reason. For hepatitis C, your chance would be 1 in 50. For HIV, it's approximately 1 in 300. So just a few examples of some sharps injuries that could potentially occur, and these are based on real examples. A sharp item can cause a cut or break in someone else's skin. So think about an accidental needle stick. That can happen in the operating room. It could happen when administering vaccines and trying to recap needles. Those germs can then spread to that person and cause a new infection. So reusing needles or syringes is especially risky because germs in the blood can spread from one person to another. Just don't do it. If proper PPE is not used during wound care, there's a potential for spread of germs from that wound to the person attending to the wound through those splashes and sprays. And then we need to be concerned about blood in the environment, like on linen or a reusable medical device. These can grow bacteria and it spreads by touch or on the devices themselves. So think about, this is one area we always like to point out, glucometers that have contact with blood. They need to be cleaned between use. The same with instruments that are reused and instruments that are reprocessed. And briefly, this is also, I want to bring this up because this is a good, always refresher. This is when we really need to have that good understanding of standard precautions. As we know, standard precautions are that basic practice that apply to all patient care in all healthcare settings. This is regardless of the patient's suspected or confirmed disease and apply to all settings where care is delivered. These practices protect healthcare personnel and prevent healthcare personnel or the environment from transmitting infections to other patients. Next slide. So step 3, we're going to actually expand on the topic and focus on what our team members should do when they see blood. The next several slides are actually going to cover what key infection control actions that are needed to prevent the spread of germs from blood to protect you, your patients, and your coworkers. I also want to note these next few slides, they're not sequential steps that need to be taken, but rather an overview of all the pieces that you need to consider. So remember that risk recognition. So as you do your own risk assessment of your healthcare role, your tasks and your current situation, you're keeping all these pieces in mind and making decisions based on your risk. We're always going to assume blood is infectious. And those infection control actions that you're going to take are to focus on preventing that blood from entering the body, as well as limiting its spread in the environment and between people. So actions on this slide that you're going to take include using your gloves if you're going to touch blood, and do not reuse or double glove. If you see blood, look for the sharps. That's always your first clue. If there's no obvious reason for the blood, look for a sharp. If you see sharps, put on those gloves and safely dispose of them, the sharps, in a sharps container. Next slide. And a few more of our IPC actions that team members should take and consider. If you're approaching a place where you know that there was just a procedure completed and you're going in there, be careful handling the drapes, the trash, the linens, anything or item that could potentially hide a needle or other used sharps. If you're the one using the sharps before that procedure, think ahead. Think about where you want to keep those sharps before you start a procedure. Think about how you're going to track them throughout the procedure and during the cleanup. And importantly, how you're going to dispose of them in a sharps container as soon as you're finished with that procedure you're involved in. And you may not even be the one doing that procedure, but if you're supporting in that role, go into that setting with that mindset. And of course, after all these actions, after you remove your gloves, you're always going to clean your hands. And this is a good time in the microlearn, if you're the one teaching it, to pull out your resources. So I'm thinking about, for this topic, the CDC's core practices, especially Section 5, which briefly bullets out and nicely outlines standard precautions. And this is an opportunity that you can review those with your team. And you can even share with them where they find these. So if they need to pull them up themselves and aren't aware, they now know where to pull up the core practices. And also tie in your facility policies and procedures that support standard precautions. Next slide. Okay, so continuing on, we're expanding into personal protective equipment. Again, this was mentioned in the OSHA standard. So using risk recognition and our knowledge of standard precautions, at this point, you are going to determine if splashes and sprays are likely in the healthcare tasks you're about to do, and be sure then to select the right PPE for the task you're doing. So take a look around your environment, think about what type of PPE you need for the situation. You want to make sure that the PPE is going to protect your skin, your eyes, your nose, and mouth, especially if you anticipate any type of splashes or sprays. Check in your environment also to make sure that you have access to this PPE, including those masks, gown, and eye protection. And remember, if we wear eyeglasses, those don't count as eye protection. After completing the task, you definitely take off those gloves right away, clean your hands, and remember that gloves are not a substitute for hand hygiene. Next slide. This part of the microlearn is expanding on clean hands, again, going back to standard precautions, and just for a mini refresher on what standard precautions includes, is that you will want to use alcohol-based hand rub or wash your hands with soap and water for the following clinical indications. So you're going to do that immediately before touching a patient, before performing an aseptic task. So think about putting in an indwelling device or handling any invasive medical devices. You're going to do it before moving from work on a soiled body part or site to a clean body site on the same patient, after touching a patient or that environment around the patient, after contact with blood, body fluids, and contaminated surface, and again, after glove removal. We always want to ensure that our healthcare team cleans their hands with soap and water when their hands are visibly soiled. The other part of this that's everyone's responsibility is ensuring that you have those supplies necessary for adherence to hand hygiene. And so do that look around. Do you have hand sanitizer dispensers? And if they are there, does it have hand sanitizer in it? And is it functioning? How many times have we walked up to a hand sanitizer and stuck our hand under it and realized that it's empty? Another key point of hand hygiene is healthy hands. So keeping nails trimmed and healthy. And I say this because alcohol-based hand rub is the preferred method over soap and water in most clinical situations, because there is better evidence of compliance compared to soap and water. And generally, these hand rubs are much less irritating to the hands and are very effective in the absence of a sink. And if you want more information on that, you can refer to the CDC guidelines for hand hygiene in healthcare settings, or guidelines for health isolation precautions, the Preventing Transmission of Infectious Agents in Healthcare 2007. And both of those are on the CDC website and in the references in today's slide deck that we'll share with you. On to the next slide and next piece of the puzzle is looking for sharps. And proper handling of sharps definitely increases the risk of blood germs spreading from one person or another through those accidental sticks or pricks. So taking care to handle needles and sharps items carefully and safely dispose of them in a sharps container is essential to prevent spread of infectious blood germs. You always want to ensure that your sharps containers are available and not overfilled. I know, it's an expensive part of healthcare to buy the containers and to get rid of the waste, but there is a fill line and you don't want to exceed that. You also need to know who to contact or what to do when they're full and notify that individual if that's not your responsibility. Next slide. So step 4 in the microlearn process is putting together all these IPC action pieces that we just went through and providing that time for discussion with your team. And this is actually really, I think, the most fun and interesting time to spend with your team for that feedback. And it's really good to have some questions. And this is part of the microlearn, is having some of these sample questions to get the conversation and to drive that team feedback. So you can start out by asking their team how they feel about the topic with questions like, well, what do you usually do when you see blood? Or do you worry that you might catch something? Or do you know who to call if you need help or assistance? Do you have all the tools and information to do your job safely? I really like this question. I think it opens up the floor for people to express concerns. It's often their observations and personal experiences, and giving that feedback on what's going well or what things are preventing them from completing their tasks. Sometimes it could be as simple as, well, I don't wash my hands because there's not a sink and nobody put a hand sanitizer in that area. Or it may be a situation, the PPE is all the way at the end of the hall and you've got to go through another door to get to it. So you know what, I'm just going to do my task. So take this time to get that feedback and have the sharing. This is also your opportunity as the facilitator, again, to pull out resources you need to touch on and even do a walk around the unit and address or demonstrate elements of the microlearn with your team. Also ask as a team, how can we help each other take the right infection control actions when we see blood to keep germs from spreading? Another real big takeaway and value of these conversations is to support that culture of safety and to recognize that accidents do happen and that we can all support each other to reduce and prevent, not to blame. Next slide. As part of the wrap up, you're going to want to leave your coworkers with a few key takeaways to prevent exposure to bloodborne pathogens. As you can see bolded out here, the 2 big takeaways on the blood microlearn is always assume blood is infectious and don't touch blood without gloves on. The infographic on the right I shared is another CDC Project Firstline material. And we encourage you to use all of these colorful graphics in your workplace when you're doing microlearns to help support that ongoing learning. A couple of creative things we've seen done is that people will put them up near their huddle board or in the meeting rooms. I've even seen them used as stall readers in bathrooms where they've inserted them in little plastic inserts for people to get that reinforcement as they go. Next slide. So as we know, accidents do happen. So what do you do if you have an exposure? First of all, you have your facility exposure control plan that everyone's going to be familiar with and know the steps in your individual facilities to take. But there's really 3 primary actions that everyone needs to keep top of mind. And if you follow and think through those, you'll be fine. First, you're going to want to clean the entry site. If you have a wound that is bleeding profusely or is very deep, you need to put deep pressure immediately on it. and go seek medical attention. If it's a smaller puncture or wound, you can wash with soap and water for 15 minutes. And this is a good time to also be aware of where your wash stations are, especially if you work in different facilities or different shifts in different parts of the healthcare system. If you have exposure to mucous membranes, you're going to want to flush the mucous membranes with water. In the mouth, that would be rinsing several times. In the eyes, you're going to want to first take out your contact lenses. Hopefully you might have an eye wash station available, and if so, flush for 15 minutes. If that eye wash station is not available, you're going to want to grab a friend and have them help you by using, take a 500 ml bottle of normal saline or lactated ringers and rinse the eye out with that. If none of those are an option, you can always resort to the sink, but you want to be sure it's tepid water, and keep the eyes open and rotate the eyeballs in all directions to try to remove that contamination as quickly as possible. Again, you most likely will need a coworker to help you with this. The second key part is you always want to report to your supervisor. And this is important because you need a quick response to your situation to reduce the risk of infection. And also, reporting as soon as possible will assist in obtaining a test from the source. This also likely will include an incident report that you and your supervisor, or if you have an occupational health team, can help you with. And this is in order to do a root cause analysis so that this can be looked at after the incident and talked about to prevent future similar incidents. And finally, again, always seek medical treatment. This is important for several reasons. If there is post-exposure prophylaxis, or some people call PEP, PEP, that needs to be done in a timely manner, as long as, and also making sure that you're checked out to determine if you're eligible or need PEP, and counseling and further follow-up is depending on your situation. So all of these 3 steps are the things you need top of mind. This all ties back to the OSHA standard. And on the bottom of this slide is the Stop Sticks link for the CDC NORA information. And these are really good tools that you can take back to your facility and look and see how it aligns with your existing exposure control plan, and use with the blood microlearns to prevent these exposures from happening in the first place. Next slide. So now we're at the point, if anyone has any questions. And I do have 2 slides. One is a resource slide page. And I don't know if all of you are aware of it, but the CDC has just gone over a major data modernization, and we have a completely new look for our website. And so I encourage everyone to go in and click and look. A lot of the URLs and links have changed. There's some archiving going on. And so it's a good time to get familiar with the great new look. So with that, I really appreciate your time and attendance today, coming out for this presentation, and reach out anytime that we can help you. Thank you.
Thank you so much, Shay, for presenting on this. If anyone has any questions later on, we will have another opportunity for, and you can always put your questions in the chat, or you can send them directly to myself or Zoe if you want to send it directly. Now we will transition over to resource sharing. So we're just going to briefly talk about a few resources that we thought might be applicable or useful for you all. And so our team had the opportunity a few weeks ago to attend the NACHO, or National Association of City and County Health Officials Infection Control Summit in Chicago. We also got to present there, and during our time, we were able to gather a few resources from other national partners. And so we wanted to share a few of those. And these are just a couple pictures. We had a booth, so we got to learn a lot about what the other partners are doing and also share what we're doing here with Project Firstline. And then this was just a quick picture of our presentation. Okay, so I think Shay mentioned this, but the microlearn that we've talked about today is also available in Spanish. So if you have any staff that are primarily Spanish speaking or more comfortable reading in Spanish, this is something that's also available, so they could use or go through this whenever you're explaining it. And this is thank you to our partners at Southern America who translated. Next, I wanted to share a cleaning and disinfection checklist that was created by the American Academy of Pediatrics. This is also available in Spanish, but I thought that this is a great resource. It's an online template that you can download and adapt in Word version, so you can change it to make it relevant to your facility. But I think in regards to urban Indian organizations, a lot of the cleaning procedures that they mention on here could definitely relate to your facilities. They also sort of take an approach that's a little bit more pediatric specific, which I know you all have kids who come to your clinics, and so it talks about the toys and things to think about, the exam room. But I believe Zoe, yes, shared this in the chat. If you go on their website, they have it in Spanish. They also have it in Word version. So if you want to adapt it to your facility, that's something that you could do. But I think it's a great template that you could start incorporating. It has a spot for initials. So I wanted to share that. The next thing that I wanted to share, so you're probably familiar with the CIC certification if you're involved in IPC at your facility. If you are familiar with the CIC, you know that that certification, it's pretty expensive. It takes a long time to get, and the eligibility requirements are a little bit heavy. It's definitely a heavy lift. So I wanted to share this other opportunity. It's the Associate Infection Prevention and Control certification. So this one doesn't have any eligibility requirements. For example, if you work in admin and you also do the IPC stuff, you could be eligible to take this certification. And it's much more feasible to do, I would say. And it's also a great stepping stone if you are interested in doing the CIC certification at some point. You could start off with this one. And so I definitely wanted to share this if you weren't aware of it. These are the steps. There's an application fee. They will review it, takes 7 to 10 business days. FAPIC will follow up with you, and then you'll schedule to take your exam. And if successful, this is a recent change. I believe it used to be yearly, but they're now valid for 5 years, which is great. If you do it, then you'll have it for 5 years. If certification is something that your facility has been looking towards doing, but the CIC is just a little too expensive or too much of a lift right now, I definitely recommend taking it. Perfect. And I just thought of something for the certification. If you have any questions about it, feel free to reach out to us and we can help connect you with the staff that we know at the FAPIC office. But anyways, we're really excited to share this graphic. This is something that our IPC team at NCUIH created. And so it's a visual and also a written checklist for UIOs and other facilities when they're transporting clients, what to do when you're doing it. So before the trip, during the trip, and after the trip. You can print this, you can laminate it, you can hang it in your vans. One side can be used as a visual reminder. This side has more of the written step-by-steps of what you can do. Obviously adapted to facility protocols, but I won't go through all the steps. Zoe will share in the chat for you. I think she already did the link, but hopefully this is something that you'll find useful. We're really excited to share it. I know it can be tricky to know what steps to take, especially when you're doing things like transportation where you're not necessarily in the facility. Hopefully this is something that can give some guidance. Okay, well, I think that brings us towards our open floor. I'll pause for a second, see if anybody has any questions, and it can be about anything from the presentation. I might start off with a question if anybody has anything. Shay, I was wondering, so if there's a needle stick that occurs But say it's a needle, for example, that hasn't been used yet, does that change at all the actions that you take afterward? So it would be immediate.
No, that's a good question. It's still considered a needle stick, so there would still be a need to do the processes of making sure you get medical attention, reporting to your supervisor, filling out necessary paperwork. On the positive side, because it has not had contact with a blood or an individual or potentially even any other surface, if it's something that is a sterile item that you just uncapped and accidentally stuck yourself, it certainly reduces a lot of risks and concerns for those bloodborne pathogens that we talked about today. But those steps are important because as a safety culture in healthcare, we want to understand why did that happen? Is it an action that can be prevented? And, you know, is it an action that might occur in the event of blood where it is not as positive of an outcome? Good question.
That makes sense. Thank you for answering. Any questions? Like I said, you can put them in the chat. If you don't want to come off mute, feel free to start shouting them out, or you can message us directly. And I'll give one more moment of silence. If you think of something after, you can always do. All right, well, I think we can move forward. I know everyone's busy, so if we end a little early, I don't think anyone post. So just kind of wrapping up in our closing here, some reminders. I shared with you the graphic for the transportation, but we have other graphics that we've created, like the one on the side here. They're all on our website, our Project Firstline website. And so you can download them, print them. This one is more of like a reminder for hand washing and touching surfaces. We have a video that you can share with your staff that talks about hand washing. We also have a new video that should be released hopefully this week. And it talks about cleaning and disinfecting in your clinic. They're 45-second videos, put them on the screen in your waiting rooms. You can share them with your staff. They're meant for you to use. And so if you're ever curious of what we have coming out, just visit our website. Okay, and then we do have a few other upcoming events in NCUIH. So I will share the link in the chat, but if you want to register for any of those, all you have to do is go there. We're going to look at behavioral health financing. Another team is looking at substance misuse and overdose among urban Native populations, and there will also be a vaccine in June. Yeah, I'm just going to look at your comment in the chat, Nikia. Hopefully I said your name right. Yeah, definitely. I think that those videos are also useful for patient education, so that they know that they need to kind of play their part and use hand sanitizer and things like that. And so our new video, we're really excited about. It starts off with the client or the patient entering with the van. So they brought them to their appointment, they come to the waiting room, they check in, go to their appointment. We know that urban Indian organizations do a lot more than just see patients. Sometimes it serves as a gathering center. Maybe you're doing sewing or knitting or beading. And so we wanted to also show a visual of the facility doing those services and reminding that you still need to clean and disinfect. But anyways, I want to thank you all again for joining us and taking time out of your busy schedules. We would really appreciate if you could give us feedback. It just helps us serve you all better and know that we're hitting the marks, or if there's anything that we can improve on, we would love to know. And yes, it will be shared with everybody. Oh, perfect. So we'll be sending a follow-up email in a couple of days. It'll have the link to the recording. So this will be uploaded on YouTube, and then also links to the presentations and any other links that we referenced will likely be included. And then, yeah, so we also shared the link to the survey in the chat. So if you don't want to scan it, you can also just click there and complete that for us. But we will go ahead and pause here. We'll keep the meeting open for a few minutes in case you have any lingering questions, or I'll go ahead and have River, if you could keep sharing that way if anyone needs to use the QR code. Or you can always use the link in the chat. And thank you, Shay, for presenting today. That was great.
Thank you for having us.
Yeah, well, while people are doing their survey, and I know we have a little extra time, when we were at the Nature Summit, we saw a presentation where someone, I think they were in New York, was looking at where are people getting their information on infection control. And a lot of people were getting it from their, colleagues, huddles, word of mouth, which, yeah, I feel like for me, it's huddles. You're there, I have to be at the huddle. I'm
Right.
starting my shift. And so I'm going to hear the information. So I think that the microlearning is great.
They are, and the topics are we have so many topics now that cover so many different situations, roles, diseases. You can really find one to custom fit and then keep reinforcing it with the good visual graphics.
Yeah, definitely. All right, well, if there's no questions, the survey link will also be shared in the follow-up email. We will go ahead and close a little bit early. Thank you again for everyone who joined today.